are the two biggest obstacles that you have come across, Dr. Zamboni, with your research?
But yes, the obstacles is, the main obstacle, in my opinion, is when you have skepticism. For me, is good, because it's a good basis for discussion. But if you should have skepticism, refusing research, I cannot understand. Because I put on the table my initial results, because I considered that were important and was necessary to have exchanges with, especially the neurological ward, that had in charge of the patients. And my dream was to work together, addressing a study that may help us in clarifying this relationship. And sometimes I found a big opposition also against further research. Also when research are ethically approved or without any possible risk or danger for patients. And this position to me was unbelievable, and certainly was the big obstacle.
Dr. Burks, what are the obstacles that you, as a neurologist, have seen with the research on the CCSVI?
Well, I've been disappointed that we didn't have better communications from the beginning, because I think the media sort of took this thing and ran with it, and I think the internet took this thing and ran with it, and I think it left the doctors sort of following the media and the internet as opposed to the doctors taking a leadership role. I think there was a lot of confusion early on, and I think that's being corrected. And I think the forum that Dr. Zamboni and I participated on today is a really good step forward to bring the groups together, and so we can say, what do we agree on, what do we disagree on, and the things we disagree on, how can we design protocols so that we'll get agreement on those. And I think that didn't happen initially. And neurologists are a very sort of strict specialty where we have very strict rules before we say a treatment is worthwhile for multiple sclerosis. And those rules are written. Every drug company has had to follow those. Every other treatment has had to follow those. And and we become skeptical unless our rules that we have decided are really important to clarify for the patient that a drug really works or a treatment really works are fulfilled. And you can't do that with a pilot study. No one's ever done that with a pilot study. And so, therefore, I think there was a conflict about, is this the cure for multiple sclerosis? Is this the liberation of multiple sclerosis? Or is this a pilot study that supports more research? And Dr. Zamboni has been very clear. This is a pilot study. This is an interesting observation. It needs to be verified and verified quickly. And I think that's what we're doing now, but nothing happens quickly in the world. And I think that he has been misrepresented, unfortunately, from what he was trying to say. I'll let him speak for himself. But he was saying, I have something here that the world should take notice of and try to duplicate. The message to the patients was that this liberates me from MS, and the neurologist better follow along, or I won't go along with my neurologist. And my neurologist doesn't look out for my best interest. Well, the neurologists are the people who've taken care of the patients for years, and I can tell you we're pretty dedicated to taking care of patients. And part of taking care of patients is to keep patients from experiencing treatments that have not proven to be successful. And some of those include, we used to give patients malaria for treatment of MS. We used to give them snake venom and bee stings and cow's milk and you name it. There are all these, there's over 100, quote, cures for MS. none of them have proven to be successful. So that's why I think the neurologists are skeptical unless the protocol of defining what is a proven treatment is followed. And Dr. Zamboni's data presented an interesting observation and challenges for us to duplicate, and we're still in the process of doing that.
Okay. Dr. Zamboni, what has surprised you the most in your research? What has surprised you the most?
What surprised me was never published. But it's a very interesting group of 18 people who were operated on during a relapse. And the symptoms recovery was very short, from minutes to 48 hours, without any treatment with prednisolone or steroids, like those steroids. And this was really beyond any of my hypothesis. The first patient was really surprising because of a mingazzini, is a maneuver used by the neurologist to understand if there is a motor function of the leg or of the upper extremities that present some deficits, and this recovery in the afternoon of the treatment completely, and the patient was capable to walk. And this probably may be the argument of a trial, because it's very rapid, and we need probably we do not have money enough, because these are really no-profit study. But if you should have, for example, 10 centers recruiting and randomizing people to ag those steroids on one side, on one arm, or to PTA angioplasty on the other, you may certainly understand that venous function is a part of the disease. And this exploratory study, to me, is very important, because when you have very short time between a treatment and a response to the treatment that can be objectively measured by independent neurologists, for example, this means in medicine in general, in the methodology of science, that there is certainly a relationship. And this really was my most experience, and is a work in progress at all. And I maintained this as a work in progress, because it will be my proposal when I find colleague, neurologist, that can be potentially interested in exploring a study like this together. Because what I felt was really, as a man, as a physician, or as a researcher, with these 18 people, was unbelievable. Because you really touch that something changed. And we need to add neurological science on this, especially what happened in the MRI, for example, or in functional MRI, I guess. But we really need of a task force on this,
Okay, Dr. Burks, what has most surprised you about the research?
Well, let me comment on Dr. Zamboni's very interesting observation. It's interesting for two reasons. First of all, he saw people get better, and that's fascinating. But he also has the possibility of doing a clinical trial that could actually prove his observation. Because the neurologist would say, well, I've had patients who have gotten better for doing nothing, and they've gotten better in a day or two after they've had an acute attack. As a matter of fact, I can remember a number of patients where I'd see them with an acute attack, and I'd want to treat them with steroids. And I'd say, but I want to get some tests on you first, because I'm not comfortable treating you with steroids until I get the test. But by the next day or the next day when I got the test results back, they were already better. And I jokingly says, you got better in spite. You might get better in spite of what I do, not because of what I do. Because people can get dramatically better very quickly. So the neurologist would be skeptical without a clinical trial. But what Dr. Zamboni has set up is a fascinating opportunity to take half the patients and treat them with steroids and half the patients and treat them with the CCSVI procedures. And it would be a very nice comparison study. And so it really sets up what he's talking about, is if neurologists and the CCSVI experts work together, we could design studies that fairly rapidly could give us insights into how we can help more patients. I'm sorry about that. Now, your question, Sharon, was what?
What has surprised you the most about the research?
Oh, the most surprising thing has nothing to do about the research.
Okay.
The most surprising things to me has to do with the Internet. The unbelievable power of the Internet. When something like this comes up, we must now deal with that in the future very seriously, because there's so many good things that can come from this Internet connection that we're now seeing. But there are also some potentially misleading things. And I think it's important that we try to emphasize how we can use it for its good, but not mislead people in the wrong direction. So that's the number one thing. The second thing that surprised me is that I've sort of seen three phases of the CCSVI discussions. There's three different approaches because what the scientific medical community hears is different than what the patients hear, and the lay press is all over the place. I mean, they're interested in selling ratings or advertisements or something, and so therefore I have seen articles from the lay press which basically says this is the greatest thing ever, and I've also seen articles that says this is absolutely terrible and nobody should do it. That was surprising to me, because if you look at the medical scientific community, what's their message? And it's a message that's being promoted by Dr. Zamboni and the doctors that were at the leadership of the Society of Interventional Radiologists and the Endovascular Surgical Societies, is that first of all, so far, the studies are inconclusive. They have not proven in the scientific criteria that this is absolutely the treatment for multiple sclerosis. And they all say the need for research is tremendous here. We must do more research before we can recommend this procedure to everybody with multiple sclerosis. And that they would encourage people to volunteer for research studies, but should be very careful about going to places that do this commercially without institutional review boards for patient safety, without strict protocols, without neurologic evaluation, without follow-up evaluation. And we're all saying the same thing. We need to understand this better. We need to get better data, and we need not to encourage people to go to places that have less than adequate rigor. So many places are now advertising that they trained with Dr. Zamboni or Dr. Dake or whoever else, and that they're really the experts in the world, and they're just as good as anyone else. Well, Dr. Zamboni, I'm sure, can help clarify this. He's probably been surprised a lot when he's gone into doing these procedures about what he's found. It turns out there's a variety of different conditions that they see, for a variety of different reasons for venous insufficiency. And you have to be experienced in diagnosing and treating these. And you need to go to the right place with the real experts.
Okay. Being a representative from a patient advocacy organization, what is the responsibility of an organization such as us, such as CCSVI Alliance? How can we be a part of the future of CCSVI?
I pray you to push together us in the same direction. Please pretend to have tests done by accredited technician or physician. Push to have treatment under IRB approval and ethic protection. Because sometimes I suspect that business is superior to science, and we need to protect the patients for understanding better and better what exactly this treatment is, what are the expectations, what are the symptoms that may relieve or what are not in case, when you may expect improvement, in what function. So we have a lot of questions completely open, and in this particular moment we cannot, as physician in general, recommend this treatment because we do not have enough data. I hope that this may increase the number also of observational studies, because we need of RCT, of course, but we need also observational study looking for specific aspect, different oncology or different symptomatology, different stage of the disease, also different vascular pathology, because CCSVI is an acronym, but there is really different shape, different situation. I found a really challenging lesion, and the people need to be aware that challenging lesion cannot be solved with minimally invasive treatment, but did a more complex and also more dangerous treatment. So it's very important that the Alliance act increasing the number of ethical studies and increasing the number of treatment, but under ethical protection.
Okay. Dr. Burks, what do you think that the patients can do to help move this along?
Well, let me comment on the CCSVI Alliance and their role, and their very positive role. It's been very gratifying for me to see how the CCSVI Alliance has dealt with this issue. And in fact, since Dr. Zamboni's creative and innovative approach to MS and his early results, second to that my most surprising positive thoughts have been, we now have an organization that speaks in a balanced way for people with MS. It provides both sides of the debate. It provides information sharing of all the results. It's not out promoting cures, and it's not saying don't do this. It's actually saying this is the data that you need to know so that you can make up your own mind. You know, there's no name calling. There's no negativity. It has supported research. We need more information. And one of the things that I've been especially pleased with is that the CCSVI has not been promoting medical tourism. Basically, you're saying, get this as close to home as possible. work with the research side of this as much as possible, and be very careful about selecting where you might have this procedure done for your own best interest. So I think it's probably been the most successful patient-focused organization that has started with a new treatment for MS, and I want to congratulate you.
Thank you. Okay, we've ran about 30 minutes, so I think that we can close. Do you have any closing statement, Dr. Zamboni? Anything else that you'd like to say?
No, I thank you. I thank you and your organization, because it's a very serious organization that promote education among patients. This is very important, and protect patients against speculative action guided by business and without any good thing for MS sufferers. And so you are the guardian of this, and I want to cooperate with your organization in this sense, in this direction. And I thank you also my colleague Dr. Burks, because he offered me a very balanced and really scientific picture of the situation today, and I thank also him very much. And so thank you.
Okay,
thank you to everybody.
Okay. Dr. Burks, do you have anything else that you would closing statement off?
Yeah, I want to say that we don't have the answers for MS yet. MS patients need a lot more help, and that we need people who have new ideas, who think out of the box. And I want to thank Dr. Zamboni for his bringing to us a creative, innovative approach to MS, and I really hope that it proves to be a very successful treatment. And also want to thank the CCSVI Alliance for presenting a balanced view of CCSVI to the MS patients and to the medical community. Thank you.